Welcome to the Deep Dive. Today we're plunging into a topic that, well, it touches so many lives, yet often leaves women feeling unheard and maybe underserved, their health and hormones.
hmm
If you've ever felt like conventional medical wisdom just isn't quite right for you, or maybe that there's a deeper understanding of your body waiting to be uncovered, then this deep dive is really designed for you.
Yeah.
We're going to challenge some long-held beliefs and hopefully uncover insights that could fundamentally shift your perspective. Our journey today is into this intricate world of hormone balance. We're putting a particular focus on the often misunderstood, yet, well, profoundly impactful role of natural progesterone.
Right.
And for this deep dive, we're drawing exclusively from the powerful insights found in What Your Doctor May Not Tell You by John R. Lee, co-authored with Virginia Hopkins.
That's right. And our mission today really is to equip you with some powerful knowledge. We'll explore not just the science, but also the, compelling history and even the underlying politics that have shaped how we think about women's hormones.
Politics, too.
Oh, yeah. We'll cover the fundamental biochemistry and, crucially, practical guidelines for achieving true balance. Ultimately, we want to empower you, the listener, to deeply understand your own body and, importantly, to intelligently engage with your doctors.
Okay.
I mean, this source confidently states that if you absorb what we discussed today, you're likely to be better informed on the subject of progesterone than your doctors.
Wow, that's a bold claim.
It is a bold claim, and we're going to unpack exactly why they say that.
Okay, let's unpack this. It really wasn't that long ago, was it, that menopause was sort of a whispered word, a subject shrouded in taboo.
Definitely.
Yet today, you see it openly discussed everywhere, books, talk shows, magazines. But despite all this open conversation, the source points to this continued great thirst for knowledge in the field. This isn't just curiosity, is it? It feels like it suggests an ongoing dissatisfaction with the treatments women are currently offered.
Absolutely. It really highlights that, many women feel something isn't quite right with the prevailing medical approach. I mean, consider the startling statistic the source points to.
Yeah.
650,000 or more hysterectomies per year just in the United States.
150,000, wow.
Yeah. Women intuitively know they're not simply, quote, victims of some mistake of Mother Nature. They sense that a hormone meant to cure them shouldn't also promote serious side effects or, even cancer.
Right.
This disconnect between what women experience and what they're told, it's led to a deep distrust in conventional approaches for many.
And for such a long time, the dominant narrative was this estrogen deficiency hypothesis, right? This idea that menopausal symptoms were primarily just due to a lack of estrogen. That was a powerful driver.
Hugely powerful.
It really fueled the success of drugs like Premarin, which became, one of the top 10 prescription drugs sold in the U.S.
That's right, a blockbuster.
And the medical approach became almost a blanket one. If, like the source says, any American woman of menopausal age complained to her doctor of any symptom, she'd likely get Premarin and a synthetic progestin.
Almost automatic.
And if symptoms persisted, they were often just dismissed as trivial or worse, maybe led to a tranquilizer prescription. It really paints a picture of a system that wasn't listening deeply enough, maybe.
Exactly. And what's truly fascinating here is how that view stands in such stark contrast to what the body actually does. The source argues that menopause should truly be regarded as a normal physiologic adjustment reflecting a benign change in a woman's life journey.
A benign change, not a disease state.
Precisely. The, quote, Western perception of menopause as a threshold of undesirable symptoms and progressive illness due to estrogen deficiency is an error unsupported by fact. It suggests this perception is often tied to abnormalities brought about by, industrialized cultures diverging from a healthy, natural lifestyle, rather than some fundamental flaw in women's biology.
And it's not like women just passively accepted these treatments either. Historically, there seems to have been this healthy skepticism, an intuition that something was off.
Definitely.
Let's think about DES, that hormone given to prevent miscarriages, only for countless mothers to discover it caused cancer in their children later on.
A tragedy.
Or Valium, once touted as this safe solution for anxiety, only to be found highly addictive. It's incredibly telling that despite, as the source puts it, intense pressure from doctors and the media, only about 10 to 15% of menopausal women chose to use conventional HRT.
Only 10 to 15%.
Yeah, it seems like many women's instincts just told them to be wary.
And this historical context brings us to a really crucial distinction, one that truly lies at the heart of so much of the confusion. The fundamental difference between natural hormones and their synthetic counterparts.
Okay, let's break that down.
Synthetic hormones, like the ones found in typical hormone replacement therapy, HRT, they have altered shapes not known in nature.
Altered shapes, like they don't quite fit.
Exactly. Think of
Yeah.
it like trying to fit a square peg into a round hole. Because of these altered structures, they aren't recognized properly by the body's natural processing plants or cleanup crews, what we call enzymatic pathways.
Ah, okay.
This means their effects cannot be tuned down or turned off as needed, nor can they be efficiently excreted. They sort of hang around longer, potentially causing issues.
Whereas natural ones.
Natural hormones, on the other hand, they maintain this delicate harmony and balance in the body because they fit perfectly into our natural systems. The body knows exactly what to do with them.
That's a huge point. It's like the
Yeah.
body knows how to handle its own stuff, but gets confused by the imposters. Let's really dig into the difference between natural progesterone and these synthetic progestins, because this misunderstanding has had massive implications, right?
Massive, yeah.
And the source highlights a key reason for this confusion, or maybe lack of clarity. Natural progesterone cannot be patented.
That's the crux of it, financially speaking.
Right. So what does that mean for the pharmaceutical industry? Well, it kind of explains their significant lack of interest in researching or promoting it, doesn't it?
Precisely. If you can't patent it, the profit motive just isn't the same. And the safety differences alone are stark. Natural progesterone, when used in doses that mimic the body's own production, what the source calls physiologic doses, has virtually no side effects.
Virtually none.
Yeah. Compare that with synthetic progestins, which come with, well, many adverse effects. These can include really frustrating issues like fluid retention, unpredictable breakthrough bleeding, or menstrual irregularities, and even a significant impact on mood, potentially leading to depression.
Wow.
You see, originally, progestins were used mainly to inhibit ovulation, making them effective for birth control.
Okay.
They were also introduced later to counteract the greatly increased risk of endometrial cancer that was seen in postmenopausal women taking estrogen alone.
So the estrogen alone was risky for the uterus.
Exactly. It was unopposed estrogen that was the culprit there. So progestins were added for protection, but crucially, they came with their own set of problems.
And the financial implications of this whole approach, I mean, they're almost impossible to exaggerate, aren't they?
Huge market expansion.
Adding progestins to estrogen therapy dramatically expanded the market for them to all women, not just those needing birth control. And here's where it gets truly, well, concerning. Even the looming threat of breast cancer didn't seem to slow down the progestin bandwagon.
Not initially, no.
It wasn't until the landmark Women's Health Initiative study, the WHI, finally showed an indisputable increase in breast cancer that the tide really began to turn.
Yeah, that study was a major turning point. It really underscores how sometimes profit motives can, unfortunately, maybe override clear health concerns for a time.
Okay, now let's talk about estrogens themselves, the family of hormones our bodies naturally produce. The source points out there are three main types.
Yes, and their effects differ quite significantly, which is a critical piece of this whole puzzle. You've got estradiol, which is most stimulating to the breast, and it's incredibly potent, 1,000 times more potent than estriol.
1,000 times, wow.
Yeah. Then there's estrone, which is second in its stimulating effect. But then you have estriol, which is the least stimulating and really notably actually seems to be protective in terms of breast cancer risk.
Protective, okay.
So the source clearly shows that estradiol and estrone increase one's risk of breast cancer, while estriol is actually the most beneficial to the vagina, cervix, and vulva for issues like dryness and infections.
Interesting.
And it's also crucial to understand that the synthetic version, ethinyl estradiol, which is commonly found in estrogen supplements and contraceptives, poses an even greater breast cancer risk.
Why is that?
Because our bodies absorb it so efficiently, but then struggle to metabolize and excrete it. It just hangs around longer, exerting its stimulating effects.
Got it. Okay, so beyond progesterone and the different estrogens, the body has this whole orchestra of other critical hormones playing their parts. Androgens like testosterone and DHEA.
The corticosteroids like cortisol, aldosterone, corticosterone.
And something called pregnenolone.
Yeah. What's really fundamental to grasp is that all of these steroid hormones are made primarily in the ovaries and the adrenal glands, and significantly, all of the steroid hormones are made from cholesterol.
So cholesterol isn't just the bad guy.
Absolutely not. It's the building block. This means that a really strict no-fat or no-cholesterol diet can actually disrupt this delicate balance and lead to hormone imbalance.
Okay, that's important.
Definitely. DHEA, for instance, acts as a crucial precursor, a building block for both androgens and estrogens. Cortisol, we hear a lot about that. It plays many vital roles regulating glucose and energy, moderating inflammation, immune responses.
Right.
Aldosterone controls our sodium and potassium levels, and pregnenolone is often called the mother hormone because it's sort of an intermediary in hormone production, like a crossroads.
The mother hormone. Okay.
But the source makes it clear that just taking pregnenolone as a supplement isn't necessarily a reliable fix if your ovaries are already malfunctioning. They might not be able to use it effectively to create the other hormones downstream.
So you need to address the root cause.
Exactly. It's about addressing the root cause, not just adding a building block the body might not be able to use properly.
So with all that groundwork laid, let's turn to a central concept that seems to tie many symptoms together. Estrogen dominance. It's a term you hear a lot, but what does it actually mean?
Yeah, it's a term that can be a bit misleading, actually, because it does not necessarily mean a woman has too much estrogen. It simply means that estrogen levels are relatively higher than progesterone. It's all about the balance, or lack thereof.
The ratio's off.
Precisely. It's a question of balance, and this is often connected to anovulatory cycles. Those are menstrual cycles where no ovulation occurs.
Meaning no progesterone is produced.
Exactly. No ovulation, no corpus luteum, no progesterone that month. And what's truly alarming is that these anovulatory cycles are described as epidemic among women in the industrialized countries, affecting even regularly cycling young women.
Epidemic. Even in young women.
Yeah. And a significant, often overlooked factor here is xenoestrogen exposure. Remember those environmental chemicals we mentioned?
Right, the petrochemical.
They mimic estrogen in the body and throw this delicate balance even further out of whack, contributing to this widespread imbalance, this estrogen dominance.
Okay, speaking of estrogen dominance and its wide-ranging effects, let's dive into bone health and osteoporosis. Now, conventional estrogen therapy has long been seen as the gold standard for bone health post-menopause. But what does the source reveal about that?
Well, the source meticulously points out that conventional estrogen therapy only slows the bone loss of osteoporosis, and crucially, only for a limited time.
It just slows it down.
Yeah.
It doesn't reverse it.
No. Essentially, the fractures prevented are actually only fractures delayed. So it challenges the very notion of it as a true long-term solution or cure.
Okay.
Now compare that to the findings for natural progesterone cream, which the source calls particularly remarkable. It emphasizes that progesterone cream can actually increase bone mineral density.
Increase it. Build new bone.
Yes, and that women who are more than 7 years postmenopausal will gain new bone and higher BMD from progesterone therapy, whether or not they take estrogen.
Wow, even without estrogen.
Even without estrogen, this is huge. It really tells us that progesterone is truly the bone-building hormone, actively promoting new bone growth, not just slowing down the loss like estrogen does.
That's a fundamental difference. So beyond hormones, what other factors does the source highlight as crucial for keeping bones strong? We always think of calcium, but what else?
Absolutely. Calcium is important, but the source points to magnesium as a key player, even suggesting it's a much greater nutritional problem than calcium deficiency for many people.
More important than calcium. Interesting.
Yeah, in terms of deficiency prevalence. Then there's vitamin B6, vitamin K, and critically phosphorus. While phosphorus is essential, getting too much of it, which is common with sodas and lots of red meat, can actually lead to bone loss by disrupting the body's mineral balance.
So it's about the right ratios again.
Exactly. It's about balance, not just isolated nutrients. And let's definitely not overlook the importance of weight-bearing exercise. It's absolutely essential for stimulating bone building and maintaining density, even well into postmenopause.
Right. Use it or lose it, basically.
Pretty much. The source also provides a nuanced view on BMD testing, bone density scans. They're valuable for tracking your personal progress over time.
Okay.
But it warns they're not accurate when someone is on anti-resorptive drugs like bisphosphonates or if they have elevated fluoride levels. These can lead to higher BMD readings, but it might be for older bone of less tensile strength or bone that's technically denser but of poorer quality.
So a high number isn't always good news.
Not necessarily, so the advice is clear. Don't panic at one low reading. It's just one piece of a complex puzzle.
That's good advice.
What's also deeply concerning, shifting gears slightly, is the significant bone loss, around 10%, that's been shown to be caused by the progestin contraceptive Depo-Provera, especially in young women when they should still be building their peak bone mass.
10%? That's huge during those critical years. Moving on to another really critical area where hormones play a profound role, the connections to cancer. This is obviously an area where the stakes are incredibly high.
Indeed. And the evidence presented here is compelling and, frankly, quite sobering. The source states unequivocally that unopposed estrogens are the only known cause of endometrial cancer.
The only known cause.
Yes, and they certainly contribute to breast cancer risk as well. But what's truly fascinating, and offers perhaps a glimmer of hope or a different perspective, is the evidence suggesting that progesterone may have a balancing or opposing role to estrogens in cancer.
Okay, how so?
Well, consider this. Specific studies have shown that progesterone decreased cell proliferation rate by more than 400% in breast cells.
Decreased it by 400%.
Yes. While in the same context, estradiol increased cell proliferation rate by 230%. That's just a dramatic contrast in how these two hormones influence cell growth in breast tissue.
That's an astonishing difference. And here's where it gets really, really interesting and raises a profound question about medical practice. The source cites research showing that breast cancer recurrence is more common when surgery had been performed during the first half of the menstrual cycle.
When estrogen is the dominant hormone.
Right, compared to when surgery happens when progesterone is dominant in the second half. It just makes you wonder why this critical timing isn't a standard consideration in breast cancer treatment planning, doesn't it?
It absolutely does. It raises a powerful question about how much we understand or apply regarding the body's natural rhythms, even in healing and recovery.
What are the implications if that's true?
Well, potentially significant for outcomes. And while we're on the topic of cancer treatments, let's talk briefly about tamoxifen. It's often used to lower breast cancer risk or recurrence, but it's not without its own issues.
Right, the side effects.
Yeah. The source notes it comes with many and sometimes deadly side effects, including an increased risk of uterine cancer, strokes, liver damage, and eye damage. And it also highlights that the uterine cancer induced by tamoxifen is often much more deadly.
Wow, that's a difficult trade-off women have to weigh.
It is. Now, regarding progesterone testing itself, there's a critical distinction the source clarifies that's really important for listeners to understand. Transdermal progesterone, meaning applied to the skin as a cream, is actually well absorbed by the target tissues, like the breasts or uterus.
Okay.
However, often blood tests don't show a measurable rise in progesterone levels after using the cream.
Why not, if it's being absorbed?
Because progesterone is fat-soluble. It's primarily carried on the surface of red blood cells, not protein-bound in the blood plasma, which is what standard blood tests measure.
Ah, so the blood test is looking in the wrong place, essentially.
Kind of, yeah. For an accurate picture of the bioavailable levels, what's actually free and available for your body's cells to use, the source strongly argues that salivary hormone assays are far more reliable.
Saliva testing.
Yeah.
Okay, that's a crucial piece of information for anyone trying to assess their actual hormone levels. Let's connect this understanding now to heart disease and stroke, another major health concern for women, especially after menopause.
Right. And the source postulates something quite radical here, that the increase in heart disease risk after menopause is due more to progesterone deficiency than to estrogen deficiency.
More due to lack of progesterone. That flips the script.
It really does. But it makes sense when you consider that progesterone levels absolutely plummet. They fall to near zero at menopause, while estrogen only falls by maybe 40 to 60%.
Ah, the drop in progesterone is much more drastic.
Much more drastic. And clinically, they observe that lipid profiles improve when progesterone is supplemented. Conversely, excess estrogen, especially unopposed estrogen, is known to increase the risk of blood clots.
Okay, the clotting risk.
Yeah, the data cited is striking. Studies showed conventional estrogen replacement therapy, ERT, increased venous blood clot risk by a staggering 200 to 360%. And women on Prempro, the combined estrogen and progestin drug, had a 41% increase in strokes.
Those numbers are alarming.
They are. And what's also really surprising is that the source states only 50% of coronary artery disease, CAD deaths in women, are associated with major occlusive disease, meaning significantly blocked arteries.
Only half. So what's causing the other half of heart attacks in women?
Exactly. It implies that other factors, perhaps vascular spasm, inflammation, or yes, hormonal imbalances like progesterone deficiency, might be playing a much larger role in heart attacks experienced by women than previously thought.
Fascinating. Okay, so beyond those major conditions like cancer and heart disease, let's explore some other common health problems that, according to the source, are often linked to this hormone balance issue.
Yeah, let's start with PMS, premenstrual syndrome. The source states there's no doubt that PMS exists, and boy, it can make a week or so out of every month absolutely miserable for many women.
So true.
And it argues the root of the problem is hormone imbalance. Specifically, that women with PMS tend to have lower progesterone than normal during that luteal phase.
Lower progesterone.
The exciting news here is that supplementing with natural progesterone during that time shows remarkable improvement, with one study cited reporting a 90% success rate.
90%. That's incredible for PMS sufferers.
It's a potentially powerful, non-pharmacological solution for a very common complaint. For migraine headaches, they're thought to be related to blood vessel dilation, possibly triggered by allergies, chemicals, or stress. Conventional treatments often carry risks of side effects, sometimes serious ones like heart attacks. As for skin problems like adult acne, especially in women, they're frequently linked to increased androgen production. And interestingly, supplemental progesterone often clears the skin.
Progesterone helps acne.
Yeah, likely by balancing out the androgens. Moving down to urinary tract problems, that postmenopausal vaginal dryness and susceptibility to infections, often caused by hormone imbalance.
Okay.
Here, the source suggests intravaginal estriol supplementation seems to be the most effective and safest estrogen to use for these local issues.
Estriol again, the safer one.
Exactly. It can significantly reduce infections and restore normal vaginal flora without the systemic risks of other estrogens. And interestingly, progesterone deficiency actually makes estrogen receptors less sensitive, which can worsen these vaginal and bladder issues.
Wow, it's all connected.
It really is. For gallbladder disease and bile flow, progesterone causes a relaxation of the sphincter controlling bile flow from the gallbladder. So for those with estrogen dominance who might have issues there, progesterone can actually improve digestion. And lastly, hypothyroidism, or low thyroid function. There's a significant gender difference in incidence, right? More common in women.
Yes.
The source links this directly to estrogen dominance and finds that correcting that estrogen dominance with natural progesterone often decreases or even eliminates the need for thyroid supplements.
Really? It can fix the thyroid issue.
For some, yes, if the root cause is estrogen dominance interfering with thyroid function. Also, high cortisol levels from chronic stress can cause something called thyroid resistance, making thyroid hormone less effective even if your levels look normal on a test.
It's truly a complex web, isn't it?
Absolutely, beautifully interconnected.
It sounds like this beautifully interconnected system that, when it gets out of balance, can just create this cascade of seemingly unrelated issues.
Yeah.
Okay, let's shift our focus now to some of these pervasive environmental challenges, starting with a term many people are becoming more aware of: xenoestrogens.
Ah, yes, xenoestrogens. They are truly insidious. They're defined as petrochemical byproducts, basically chemicals derived from petroleum that have potent estrogenic effects, but are foreign to our body.
Foreign estrogen.
Exactly. And what makes them so problematic is that they are non-biodegradable and fat-soluble.
Meaning they stick around.
They stick around and they build up. They accumulate in our fatty tissues over time. And the sources are alarmingly widespread. Industrial waste like PCBs and dioxins, meat from livestock-fed estrogenic drugs, waste from the sewage treatment plants containing things like nonylphenols,
Oh, wow.
even the synthetic estrogens and progestins flushed down the toilet that then work their way back into the water supply and food chain. Then you have the petrochemical pesticides, herbicides, and fungicides used in agriculture, and the plastics we encounter every single day. They are virtually unavoidable in modern life.
It sounds overwhelming.
It can feel that way. And what's truly concerning is the extreme susceptibility of developing embryos to these substances. Exposure in the womb can potentially lead to a lifetime of reproductive problems.
Oh, no.
The source even goes a step further, speculating on their potential role in fetal influence by the xenobiotics, affecting things like sexual preference, citing some studies on animals and even daughters who were exposed to that drug DES in utero.
Wow, that's profound.
It's a profound thought, yeah, that our modern environment could be shaping us in ways we don't yet fully understand.
So with these ubiquitous xenoestrogens seemingly all around us, what can we actually do to reduce our exposure? The source does provide some actionable steps, right?
Absolutely. It's not hopeless. The first is to be really mindful of your food. Try to eat hormone-free meat and dairy products and eat organic fruits and vegetables as much as possible to cut down on pesticide exposure.
Okay, food choices. Makes sense.
Beyond food, it advises avoiding toxic cosmetics, things like nail polish, hairspray, which can contain endocrine disruptors. It also recommends against using fabric softeners and staying away from petrochemically based perfumes, or air fresheners.
Fabric softeners too, huh?
Yeah, they coat fabrics with chemicals. And finally, just be aware of noxious fumes from everyday things that off-gas chemicals like new carpeting, fiberboard in office furniture, and even the emissions from copiers and printers in office settings.
So be mindful of indoor air quality.
Exactly. It's about making conscious choices where you can, reducing the overall load.
That's a lot to consider in our daily environment. Okay, now let's pivot to the absolutely critical role of diet and nutrition in all of this. What foundational advice does the source offer?
Well, the source makes a really strong case against sugar and refined carbohydrates, calling them pretty much the foundation of obesity and heart disease.
The foundation. Strong words.
Yeah, they cause these big surges of glucose in the blood, which over time leads to insulin resistance. This not only promotes fat formation and abnormal cholesterol, leading eventually to clogged arteries, but the source also issues a really stark warning. Cancer cells happily use it, sugar for energy and growth.
Wow. Cancer food.
Essentially. So the solution then is pretty clear. Try to not eat sugar and refined carbohydrates. It's also important to get enough protein that helps stimulate glucagon production, which helps prevent those sugar cravings, and to include some fat in your diet. Healthy fats.
Healthy fats, right.
When it comes to carbohydrates, the best approach is focusing on complex carbohydrates, things like whole grains, vegetables, nuts, seeds, beans. They break down slowly and provide sustained energy without the big glucose spike.
Okay, what about fat specifically? There's
Yes.
so much confusion there.
Yeah, there is. The source recommends olive oil and modest amounts of butter for cooking and baking as being health supporting. However, it strongly advises avoiding those highly processed polyunsaturated or hydrogenated oils made from soy, corn, nuts, and seeds because they tend to go rancid easily and can be inflammatory.
Okay, stick to olive oil and butter mostly.
That seems to be the advice. And regarding specific nutrients, there are some important nuances. Be cautious with iron supplements, especially post-menopause or for men. Iron builds up in the body over time, and excess iron can lead to undesirable conditions like enlarged liver and cirrhosis, diabetes, and maybe even cancer.
So don't supplement iron unless you really need it.
Exactly. Only if you're diagnosed as deficient and it's monitored. Then you have the crucial B vitamins, folic acid or folate, B6, and B12. These are vital for protecting against homocysteine damage, which is a significant risk factor for heart disease. The source points out that the issue isn't necessarily eating red meat itself, but often a lack of these specific B vitamins needed to process its components properly. Magnesium is highlighted again as potentially a much greater nutritional problem than calcium deficiency. It's vital for bone mineralization and, unfortunately, often depleted in our modern soil.
You need more magnesium.
Likely, yes. The source also briefly touches on the benefits of vitamin D, vitamin K, vitamin E, chromium, copper, manganese, and selenium, underscoring their broad importance for everything from bone health and blood sugar regulation to metabolism and immune function. Also really important are phytochemicals and phytoestrogens. These are natural compounds found in fresh vegetables, fermented soy products, and certain herbs like red clover, licorice root, anise, and fennel.
Phytoestrogens. Aren't estrogens bad?
Ah, good question. These are plant-based and much, much weaker than human estrogen or xenoestrogens. They can actually be beneficial because they can gently displace estradiol from its receptors. Think of them as taking up the parking spots where stronger, potentially problematic estrogens might otherwise bind. So they can act as weak antiestrogens, helping to balance hormone effects naturally.
Okay, so they're like gentle balancers.
Exactly. And finally, let's not forget water quality. The source strongly advises filtering your tap water, ideally with a ceramic or copper zinc filter, to remove chlorine, heavy metals, things like benzene, and bacteria. It states, quite frankly, that most water that comes out of your tap is now polluted.
So filtering water is non-negotiable.
Pretty much for optimal health, according to this perspective.
That's a profound awareness to cultivate about our daily environment and diet. Okay, now let's turn to stress and adrenal health, which are so often overlooked in the hormonal conversation, aren't they?
Absolutely, and critically linked. The source notes that adrenal exhaustion or low adrenal reserve is caused by chronic, unremitting stress, a condition it believes is practically epidemic among working mothers, for example.
Adrenal exhaustion. Sounds bad.
It is. It can lead to really debilitating symptoms like just crushing fatigue, erratic mood swings, and eventually impairment of steroid hormone synthesis, meaning your body struggles to even make the hormones it needs. What's more, long-term high cortisol levels, The main stress hormone from that chronic stress can lead to something called hormone resistance.
Hormone resistance. What's that?
It means all your other hormones, including thyroid, insulin, progesterone, estrogens, testosterone, they all become less effective, even if their levels seem normal on a blood test. It's like the body's cells just stop listening properly because they're constantly bombarded by stress signals.
So stress makes everything else work less well.
In essence, yes. Practical solutions involve actively de-stressing your life, which is easier said than done, I know, but also getting plenty of sleep, maintaining that balanced diet we talked about, and incorporating practices like meditation or mindfulness. Eliminating sugar and alcohol is also really key for adrenal health.
Okay.
The source also adds an interesting point. Progesterone is a precursor to the cortical hormones, like cortisol, and sometimes small physiologic doses of natural hydrocortisone, which is bioidentical cortisol, can directly support adrenal function if needed under guidance.
Interesting connection back to progesterone. And finally, let's quickly touch on digestion and gut health, which are increasingly recognized as just foundational to overall well-being.
Absolutely. The gut is central. The source makes a surprising but really crucial point about heartburn. It states it's rarely caused by too much stomach acid, contrary to popular belief in advertising.
Really? Not too much acid.
Yeah, it argues it's most often caused by too little stomach acid, especially as people get older. This leads to food not being digested properly, fermenting and irritating the esophagus, causing that burning sensation.
Oh, the opposite of what we think.
Often, yes. Simple remedies suggested include just drinking some water before meals to dilute stomach contents slightly, or even taking a tablespoon of apple cider vinegar in water, which can actually help restore proper stomach acidity for digestion.
Huh. Apple cider vinegar for heartburn.
Yeah. Beyond that, the importance of probiotics, the beneficial gut bacteria, cannot be overstated. They are crucial for a robust immune system, since so much of it is in the gut, for B vitamin production, cholesterol reduction, and yes, overall hormone balance too.
Probiotics are cool.
Especially important after taking antibiotics, which wipe out good bacteria, and also as we age because our natural gut flora can decline.
This has been such an eye-opening deep dive into just how interconnected our hormones, our environment, and our lifestyle really are. Okay, now for the practical takeaways for you, our listener.
Yeah.
How do you actually empower your own hormone journey with all this knowledge?
Right, the what now? A key practical step is understanding how to accurately test your hormone levels if you choose to do so. The source reiterates the value of saliva hormone assays over traditional blood tests, especially for figuring out the bioavailable levels of hormones like progesterone and DHEA.
Saliva, not blood, for those. Why again?
Because, as we mentioned, blood tests often measure hormones that are protein-bound, meaning they're inactive or just stuck in transit, not actually usable by your cells. Saliva tests, however, give a much more accurate picture of what's actually free and available for your body's cells to use at that moment.
Okay, that's a really key distinction.
Huge distinction. Now, when it comes to actually using natural progesterone supplementation, the source emphasizes that dosage is highly individual. Sensitivity differs tremendously from person to person.
So no one-size-fits-all dose.
Definitely not. It recommends starting with small physiologic doses, maybe around 15 to 20 milligrams per day, mimicking what the body might normally produce. However, it also notes that sometimes higher doses might be needed initially, maybe for the first 2 to 3 months, particularly for women who've had a long-standing deficiency.
Why higher at first?
The idea is that this helps to replenish body fat stores of progesterone, as progesterone is stored in fat tissue. Once those stores are built back up, the dose can often be lowered. Now, regarding potential side effects, the source is quite clear that most reported issues people experience from progesterone cream are usually due to one of two things. Either gross overdose, just using way too much, or using creams that contain a mix of other hormones or synthetic ingredients.
So check the ingredients carefully.
Absolutely. Pure progesterone cream is key. It's also important to understand that sometimes initial estrogen-dominant symptoms like temporary water retention, headaches, maybe swollen breasts can occur when you first start progesterone.
Why would that happen? Isn't progesterone supposed to help that?
It is, but think of it like your estrogen receptors have been sleepy or downregulated due to the long-term lack of progesterone. When progesterone comes back on the scene, those receptors suddenly wake up and become more sensitive to the estrogen that's already there.
They get more sensitive temporarily.
Exactly. But the good news is these initial symptoms usually disappear within 2 weeks to 2 or 3 months as the body finds its new, healthier balance.
Okay, good to know it's usually temporary. What about women who've had a hysterectomy? How does all this information specifically apply to them? Does it matter if the ovaries were removed or not?
Great question. Yes, it matters hugely. If the ovaries are removed along with the uterus, an oophorectomy, then women certainly need progesterone not only for its own benefits, like bone health and mood, but also to balance any supplemental estrogen they might be taking.
Need progesterone to balance the estrogen.
Absolutely. The source emphasizes a critical warning here. No one should be taking unopposed estrogen without progesterone because of those increased risks, particularly uterine cancer if the uterus is still present, but also potentially breast cancer and clotting risks even without a uterus.
Okay, what if the ovaries are left?
If the ovaries are left and still functioning, they should still be producing progesterone, at least cyclically premenopause. Postmenopause, ovarian progesterone drops dramatically anyway. The source also points out that testosterone deficiency is quite common after ovaries are removed, affecting energy, mood, and libido.
Testosterone too.
Yeah. And that can often be effectively treated with low-dose transdermal testosterone to restore balance, alongside progesterone and possibly some estrogen.
So with all this really groundbreaking information, what does this mean for integrating this knowledge into our lives and becoming true self-advocates for our own health? Can progesterone interfere with other medications?
That's a common concern. The good news, according to the source, is that small physiologic doses of progesterone per se won't interfere with non-hormonal medications.
Ugh.
In fact, quite the opposite is often seen.
How so?
Well, the source often sees natural progesterone actually improving conditions such as high blood pressure, low thyroid function, and arthritis, potentially allowing people to reduce or even eliminate the need for medications for those conditions, always working with their doctor, of course.
That's fantastic potential.
It really is. And it also has this inherent anti-anxiety effect, which could potentially eliminate the need for sleeping pills or antidepressants for many women who find their anxiety is hormonally driven.
Wow.
The source truly believes and conveys this passion that a quiet revolution is going on among those who have discovered natural progesterone and are happily and healthfully using it, really transforming their health from the inside out.
What an absolutely illuminating deep dive. Today, we've truly explored how understanding and naturally balancing your hormones, particularly this often overlooked progesterone, along with careful attention to diet, stress management, and reducing those environmental toxins. So it can dramatically improve health outcomes. It really challenges some deeply ingrained and, as we've seen, sometimes harmful medical narratives.
Yeah.
It feels like it empowers you, the listener, with a more holistic and maybe more effective approach to your own well-being.
Indeed. And if we just pause and consider the profound influence of factors we often don't acknowledge enough, like these ubiquitous environmental toxins we discussed, or maybe the pharmaceutical industry's profit motives shaping some conventional health advice, it really raises an important, maybe provocative question for us all, doesn't it?
Which is?
What other truths might be waiting to be discovered about our bodies if we simply look beyond the accepted narrative sometimes and truly learn to trust our own intuition combined with informed inquiry? We really hope this deep dive encourages you to perhaps take that critical next step in your own health journey, asking those deeper questions, seeking a fuller understanding, and ultimately finding the unique balance that feels genuinely right for you.